Okay. Under the subheader, some basic tenets of understanding and defining substance use disorders. So now this corresponds with the starting on page 546 in your DSM 5TR. This is under diagnostic features of substance related disorders. Let me say that again. Substance related disorders, subheader substance use disorders, diagnostic features. So this is where these just some highlights from this section here before we get into these key terms of impaired control, social impairment, risky use, and pharmacological criteria, which will be the next video. Okay, so some basic tenets of understanding and defining substance use disorders. So the individual continues to use the substance despite significant substance-related problems. I think of them as how I think of them and talk to clients about them are health and or social problems, right? Um, so we'll just take alcohol for example. So a health problem may be um, additional unwanted body weight or unstable blood sugar can be or erosion of your esophagus. These would be health consequences. A social consequence would be legal problems, relationship problems, occupational problems that are related to substance use, either being under the influence during certain activities or being unable to perform those activities because of the substance use. This is also helpful when trying to, if a client does come to you and says, I think I may have a sex addiction, or I may have a shopping addiction, or gaming addiction, uh, helping them evaluate for themselves, or you and your client evaluating together, well, what's going on in your life? Are there problems, health and or social, directly connected to um, that behavior? And if the answer is yes, but yet you persist in doing them anyway, why is that? And then within there, you can begin to, without the aid of diagnostic criteria, begin to help one get your own head around what they're bringing to you in terms of that concern, and seeing one, if treatment makes sense, and two, how would you go about doing that. So that basic concept of continued use despite problems related to it, I think can be helpful beyond just the substance specific addictions or substance related addictions. Um, Caffeine itself does not have, there's no caffeine use disorder diagnosis. There is only criteria for intoxication and withdrawal. But those can be significant. So even though many of us use caffeine on a daily basis, um, uh, it can be, you don't want to assume that it can't be a problem for someone, because and it can. So anyway, intoxication withdrawal for caffeine, no use disorder. Um, Cultural context is in social context, as with everything we talk about, right? Thematically across the DSM in this course, making sure that you're incorporating um, cultural cultural concepts and social circumstances. So um, substance availability and even policy, local policy around drug use. So, for instance, can policy around legality and access of marijuana be connected to some people's development of a use disorder? So that's a question, right? And just something that you can incorporate into when you're doing assessments for substance-related addictive disorders. There is an underlying change in brain circuits that may persist beyond detoxification. Um, Obviously, most of the time, or most of you are not going to work in settings where you have sophisticated brain imaging capabilities and specially trained radiologists to read those images to understand, physiology, brain physiology changes. Um, but why I included this in here is that people can really struggle with discontinued use of whatever that substance is for a very long period of time beyond detoxification, and even the normal expected time based on criteria of withdrawal for that particular substances. So, in other words, well, let's talk about opioids for a second. So, while there can be an expectation of a week to 10 days, and we'll go back over this when we get to this point, about expected time for serious physical and psychological impacts of withdrawal from, let's say, heroin. I've worked with clients who complain about psychological and emotional, psychological, and even physical symptoms, that withdrawal type symptoms, many months beyond their detoxification protocol without relapse. When meaning circumstances where you know because they're in a or know as much as you can because they're in a more constrained treatment setting, um, that they haven't relapsed, or the best you can tell. But those withdrawal complaints can persist many months beyond um, detoxification. So that's why I included that there. Um, Relapses and intense drug cravings can occur when individuals are exposed to drug-related stimuli. Um, two things on this. One, um, sometimes even without direct exposure, um, there can be. So, in other words, um, someone can go into uh, someone who consumed alcohol in a bar, or consumed alcohol in a problematic way at sporting events, or at a bar or an alcohol serving place that's built around sporting events. Um, Going to sporting events, or particularly those same sporting events, can be definitely very challenging for them, and create intense drug cravings. Um, but for some people, they can experience that same thing even if they um, are like, if you can conceptualize, if you're in the area, in downtown Baltimore, if you can conceptualize what it would be like to drive past the Raven Stadium on 95, right? You see it off in the distance, you're not going right by it, or let alone in it. But someone who may have had, that their heavy use was directly connected to going to sporting events there, even just driving by it on the interstate, and having it in their peripheral vision because they're driving a car, may suddenly create intense cravings for them. Just as an example of how drug-related stimuli can does not have to be like right in their face. Um, and then the other thing on that was, this is also something in my opinion, it's not from the book, that can be extensible to non-substance forms of addiction that for which we don't have diagnoses. For someone who is uh, struggling with addictive behaviors around internet-based pornography, um, even looking at images on social media that we wouldn't necessarily interpret as pornography, but clearly sexual and provocative, or sexually provocative in nature, may create cravings to go back and engage in viewing what we would, most people would consider as pornography. So, again, as an example of how this you can extend this concept um, beyond just substance-related addiction. Okay. Pathological pattern of behaviors emerges and persists related to the use of the substance. Absolutely. One of the things that people can really struggle with is their own self-esteem, and also regard of them by others, including people who are important in their lives, like family members, because they do things um, to persist the continuous acquisition of substances. They do things that they don't feel good about. Excuse me. That certainly other people don't feel good about, and that can relate to and then that can create depression, anxiety, and just a very low self-esteem that is a vulnerability in their recovery. So, and that's a very delicate thing to help people through, because on the one hand, I think accountability for behaviors that are harmful to other people or harmful to society, it's important for them to have accountability around that, because there's no recovery from it if there's not accountability, um, meaning recover from like how you feel about what you might have done. But at the same time, having compassion and empathy and understanding is equally important, because if someone regards themselves as a piece of garbage, um, it's going to be very hard to convince them to care enough about themselves to walk that difficult journey of recovery and sustained recovery. So again, that last bit there, last minute or so, is not from the book. That's just some additional observations from me personally for your consideration. Okay, so we'll take a pause there.